I'm Dr. Michael DeTola.
And I'm Megan Strong.
In this week's Case of the Week, a doctor's bark is worse than his missing bite.
And can you snort or sniff your way to a stress-free dental visit?
And a man pulls a plane with a rope and sees the bemused resignation of 4 Hungarian cheerleaders and wins a plastic model plane, and that's about it. That and more on today's Chairside Live. Hey now, welcome to episode 57 of Chairside Live, the 4th of July episode. Mega Lega Ding Dong, how are you doing today?
I'm feeling rather patriotic. I've got my navy and white dress on and my red nails.
Wow, I've got blue and white and some gingivitis for the red mixed in.
You actually have red on your tie.
I do, thank you.
Yeah.
It's pretty subtle.
Yeah.
I was going to go for the whole Uncle Sam outfit, but turns out that it's nowhere near Halloween, and it's pretty tough to rent something like that on short notice if we're not near that.
Yep.
Well, good. We'll celebrate. I wish we had brought some fireworks, perhaps, in. I don't know.
Yeah, I would love that, but unfortunately they're illegal here. So.
Well, I do. I bought some in Mexico last year, and I'm going to be lighting them off during the news stories. You'll see them in the back. Pay no mind. Just keep reading and hope I don't set your hair on fire or something like that, like Michael Jackson in a Pepsi commercial.
Oh, God.
We got an interesting case of the week for you. I was walking through the implant department the other day, and I saw a case that looked like it was going to go okay, and then I noticed there was something missing, and now it's going to be a little difficult, and we're going to have to get the patient back in to make this thing work. In fact, let's go ahead and take a look at that now. Walking through the implant department the other day, saw a case that I thought was interesting. It's an impression that came in from a doctor, and the impression looks okay. It appears to be a two-step impression. You'll notice that the two layers of material don't appear to be blended together real well as they typically are in a simultaneous impression where we see a really close blending of the two where it's almost impossible to tell the two apart. It does look like they set at slightly different times and they're sitting on top of each other, and it looks like they could be peeled apart just slightly, and again we don't see the blue material coming all the way across. We always get a little bit worried that we might have a double impression when we don't see both layers of materials represented all the way across the arch on both of them. We really like to see that all the way from the posterior area on this side over to the posterior area on the other side. But it's a closed tray impression, as we can see when we flip it over, and the doctor did use closed tray coping, so that part was nice, as we'll see when we look at the model here. So looks like we're going to be able to work with this. Probably not perfect, but certainly definitely a lot better than some of the impressions that we receive. And so as we take a look at the impression itself, definitely looks like we're going to be able to work with this. The doctor's requested a PFM bridge from 19 over to 26, and really the issue with this case as we come in and look at this is that we did receive an opposing model, and we've got that as well. What we don't have with this case is any sort of a bite registration, and that's going to make this very difficult to deal with, as you can well imagine, because we've only got 4 remaining natural teeth here. On the lower arch, we do have the entire opposing arch, but of course with no teeth over on this side, it's anyone's guess as to where these teeth are going to go. What we do happen to have is a study model before these teeth were extracted and the implants were placed. And if we try to hand articulate these study models from before and put these together, it looks to be the most natural position for these teeth is that the patient actually comes together in a class 3 relationship. And that's where the wear facets, and that's where everything really seems to line up. You can see we've made a couple marks here with the class 3 cuspid and molar relationship. And we actually called the doctor and confirmed this, that the patient is in fact a class 3, a natural class 3, and that this is where the patient bites together. But even knowing this relationship, if we try to hand articulate it this way, it's pretty difficult. We can lock it in over on this side and say, okay, that's where it is, but how in the world are we going to get the vertical over on this side? It's just impossible to guess, try to get this spatial relationship and guess where this is going to be. It's pretty impossible. Now, sometimes what I've seen the technicians do, say in the crown and bridge department, for example, is jump the bite. And so what they'll do is they'll take a study model like this and they'll hand articulate it. So if we know, for example, that this guy's a class 3 and we feel like, okay, this is actually a pretty good representation of where this patient belongs. Sometimes we'll even send a photograph back to the doctor, and have them verify it. We'll take impression putty and we can push it against the lingual aspect, not so much of the teeth, because usually those have been prepared, and we'll push it against the palate and the teeth if they're remaining, say, for example, on the upper, and against the vestibule, the lingual vestibule, on the lower. And so we'll just take impression putty and really push it against the back of there and make an index, if you will, of any remaining teeth and, say, the upper palate and then the lower vestibule, and try to really get something where we can take that and then take the lower model, in this case where the implants are, and then hold it in and push that together. But you can see from the impression, because it was really lacking in the area of the lower vestibule, that we just don't really have enough anatomical information here to be able to even jump the bite. You know, I'm not saying that jumping the bite like that is really a great technique. It's still kind of hacky in a sense. It'll do in a pinch, you know, if you don't have the bite registration and the patient lives 100 miles away and it'd be really difficult to get them in, or if we've lost the vertical completely and we don't think we can get it. You know, using that putty on the lingual surfaces of the study models will at least get us close, and if the doctor's willing to spend some time grinding in the occlusion and is okay with us guessing. But here, you know, you can see that on the study model, well, we've got some great information there. That appears to have nice information in the vestibule where we could push the putty against there and get some information here as well. But here we really don't have much information there, so we're going to be guessing. So really what we need to do here is a bite block, but again, we don't have a lot of information here. We can't wrap that very far down. And even in the buccal vestibule, we don't go very deep and we don't have a lot of room, so we're really going to need to keep it confined to the top of the alveolar ridge. And so we're going to need to put a couple temporary abutments in here to have it sit down on the top for this wax rim. The doctor said he didn't want to pay for those, but doctor, you're just going to have to bite the bullet on this one and pay for those. I think they're like $6 each, so come on. You're going to need to man up, add $12 to your fee, or just eat the difference, because we're going to need a wax rim that's going to sit down and engage into a couple of these, just two, maybe one here and one here, so it's going to sit on the top and not wiggle back and forth. And the other thing about these wax rims, you know, base plate wax is a notoriously inaccurate material. The patient can bite into it and squish into it, but it distorts really easily. It could be hot in the back of a FedEx truck as well. So I'm going to suggest that you cut it back and then really put some cross hatches in the top with a hot Bard Parker knife or a lab knife, and then squirt some bite registration material onto the top of that and have the patient close into that. Much more stable. And even if the bite registration material comes off the wax rim, it'll fit back in because you have those little cross hatches on the top of it. And that's way more stable. When the patient bites into that wax rim without the bite registration material, it's just kind of mushy. And then when we go to take the opposing teeth and push it into the wax, it distorts the wax and pushes it around, and it's never a very stable bite. So it's fine to use wax for the bottom part of the rim, but when the opposing teeth come in contact with it, it works much better if we have actual bite registration material for the portion that comes in contact with the opposing teeth. So all's not lost on this case, but we definitely want to use a couple temporary abutments here to hold the wax rim in place, and then use some bite registration material for the patient to actually bite into. And that being done, we get an accurate bite from that, we should be able to have a case that ends up being very successful.
And now let's go to a segment we call Viewer Mail. This week's Viewer Mail comes to us from Marshall Brothers from Florida, and he writes, Dear Dr. Datola, I really enjoyed the 50th anniversary episode and the case of the week with the telescopic coping. But having dealt with uni-built dentistry and precision attachments, I would definitely recommend cementing the primary crown and the 4-unit bridge simultaneously to prevent the slightest possible margin of error. Thank you for your presentations.
That's actually a great point, Marshall, and that's, I should have brought that up, and that really makes a lot of sense, and that's one of those things where you think that you could put that one down first and then be able to put the bridge on top of it. and theoretically it should all work, but in dentistry we have teeth that move just a little bit, and so even though on a stone model where things don't move it should work, the way teeth shift around it could move. And so Marshall's idea to put it all down at the same time works a lot better, and that reminds me, Marshall, a lot of times of when you make a crown, for example, a new crown underneath a partial that's got a clasp around it as well. You know, I remember making that mistake as a young dentist. I know I still appear very young, but as an even younger dentist, where I cemented a crown into place, then tried to seat the partial over it after the cement had already set, and it would not go down into place, and the rest wouldn't seat back into the rest, and so it was a big problem. And I learned then to put the crown into place and seat the partial over it while the cement was still setting, just in case there had been some movement. And if nothing else, I was going to do some instant orthodontics on that tooth and move it and get the chance to do it before the cement had completely set. So that makes a lot of sense. And just yesterday, as a matter of fact, seating some no-prep veneers, the same kind of thing, because you'll try them in and you go, oh, they all fit well together. But you really can't cement them all at the same time, and so you'll put 8 and 9 in together, and then maybe you'll put in 10 and 11, and those will go in together. And then as you work your way back, all of a sudden you'll cheat all the space, and you'll go and you'll finally put in that last bicuspid, and it won't go in. And in this case, I was trying to put in tooth number 10, and it wouldn't go in, and I cracked it, and I had to make a new one. Same type of thing. If you could put them all in at the same time, it would be better, but with no prep veneers, they just don't fit that way. And so I was cheating space, and with no prep veneers, I always find when I get to that second bicuspid, it won't fit. Your point's well taken, and that would be the best way to do it, is put those in simultaneously just to make sure they all go down. So thank you, Marshall. Appreciate that. And I have something for Marshall for being kind enough to write in and point out that I could have been slightly more correct in my answer, or a lot more correct. And that is the good old-fashioned reverse prep kit. Nothing better than using depth cuts to make sure that you give your technician the best chance at restorative longevity and an aesthetic restoration as well. Marshall, you probably don't need it, but I find depth cuts are the best way to ensure that I give my technicians the most amount of room to not only have a restoration that's going to last for decades, not years, but be nice and aesthetic at the same time. Do you have anything for Marshall?
I do, in honor of the 4th of July.
Would it be a muffin?
No, sorry. Those were...
No baked goods?
No, they're all gone. Can't even pick it up. Here we go. Ready?
Yeah.
Ta-dun, ta-da! Look at that.
What does that have to do with the 4th of July?
It's happy and
draw,
fun and celebration.
Look,
we're cheersing.
Yeah, we are. Look at, I held it the wrong way. You can't see the logo on my cup.
I know, it's... Oh, you know what? Actually, stop. You asked if there was any muffins. No, but there is one leftover crumb right by your head.
Look at the grease circle around it.
Right.
That's kind of sick.
So you know it's good. It's all butter right here, 100%.
It is, and it's all soaked into that. It's all greasy like my Italian skin.
Great, wonderful. So you get a little bit of a taste of a muffin and then this beautiful photo as well.
Awesome, Marshall. Well, I hope you enjoy that. Feel free to eat that little bit o' muffin if you choose to. And I will sign that as well. And while I do that, Megan, do we have any news?
Yes.
All right.
Needle-phobic patients may soon have another option in the dental chair if a new nasal mist gets FDA approval. The nasal spray is called Covacaine Mist and is designed to anesthetize the maxillary arch. The spray is said to be less harmful to the body's organs because it does not circulate in the bloodstream for as long as the injected version. It wears off more quickly, so that means less drooling. The product was inspired by a nosebleed treated by a nasal drug spray that just so happened to numb the patient's upper teeth as well. Research shows more than 70% of patients are willing to switch to a dentist that offers the needle-free mist. The FDA trials for approval should be done by the end of summer.
What the hell's wrong with the other 30% of the patients who won't switch? I mean, that's crazy.
They like pain? I don't know.
You know, actually, maybe that just says that they have that much trust in their dentist that they're not willing to switch to another dentist, but they should at least go back. I'd like to see the follow-up question and say, would you at least demand that the dentist that you're seeing allows you to go see it? Because if you're talking about teeth 7, 8, 9, and 10, which I work on a lot, those are some really painful infiltrations to give. And I give them really slow, ridiculously slow injections. I mean, I'm like 2 minutes for a carpal underneath teeth number 8 and 9 because you're right underneath the nose. Like they always say on Shark Week on Discovery Channel, if you're being attacked by a shark, to hit it in the nose because there's so many nerves there, and it's a really painful area. And to be able to give somebody a squeeze bottle and go and get maxillary anesthesia would be amazing. I'm signing up for this. I'm ordering this as soon as I can get it, and I'm going to use it on everybody I can. I mean, that's just absolutely fantastic. If it works. I mean, hopefully it's going to give us 45 minutes of pulpal anesthesia, but I'm super excited about that.
And just think for the positive effects of this, if people now will say, okay, yeah, fine, I'll go to the dentist, and then all these people who would never go to the dentist before, you know, because they're afraid of the needles, now are getting treatment, and that is just incredible. And for me, I'm not needle phobic. I mean, of course, I don't like it, but I would definitely opt for the nasal spray. But even as a non-needle phobic person, I'm still like, sign me up, you know? So I think if it works, it'll be an incredible advancement.
Right. You're actually more phobic of the word anesthetize than a needle.
Oh, thank you for just throwing me under that greyhound right there.
And
it's a hard word to say.
It is a hard word to say. It's one of those words that if you've been in dentistry for as many long, tedious years as I have, it gets easier to say. But you're right. There are a lot of people who avoid coming to the dentist, and they are the ones who would be the first ones to come because they've been ignoring cosmetic issues. And if they could come, and in sleep apnea, i.e. your husband, we see a lot of people with obstructions in their nasal passages, and it's difficult to get up there with a camera and see. I was at a course recently where an ENT doctor came in, and she would put a camera up people's noses. It did not look comfortable. And to numb them up, she had a long Q-tip that she dipped in a numbing solution and rammed that up their nose. And you could see like their eyeball get pushed to the side. And I thought,
they start crying.
Yeah, and if they had a spray like that, that would numb the nose as well. Then you could take that camera and go up and find those nasal obstructions and the turbinates and stuff like that. So in addition to numbing the upper teeth, it would make it easier to scope somebody's nose as well, that nasopharynx, and look for those obstructions.
Yes.
Anything else?
Yes. A man from Hungary recently pulled a 50-ton commercial plane using just his teeth. The strongman set a new record for the country when he pulled the plane approximately 128 feet in 52 seconds at an airport in Budapest. Female cheerleaders encouraged him on the sidelines as he placed the yellow rope in his mouth and began to pull the plane. After completing such a feat, the man was handed a model plane, which he promptly stuck in his mouth.
I'm glad you sent me the pictures on this, because I wanted to see what the cheerleaders look like. I'm not familiar with Hungarian cheerleaders. I just wanted to see.
Yeah, and how do they stack up compared to Rams cheerleaders?
Well,
are the Rams even around?
Well, no, the Rams, they moved to St. Louis a couple decades ago. Still a source of heartbreak for those of us in Orange County. Thanks for reopening that wound.
You know, actually, really quick, why I say that is because my PE teacher in high school was an ex-Rams cheerleader. So whenever I think of cheerleaders, that's the first thing I think of. That's why I said that.
The first thing you think of, is that? Yeah. It's also a great joke from The Simpsons in this one episode where Homer doesn't want to go to church, and so he just talks to God on his own and stays home and watches football. And God asks him. They're having this conversation, and God asks him if how are the Rams doing, and Homer has informed him that they moved to St. Louis. So they don't look really like the Dallas Cowboy cheerleaders. That's kind of the prototypical American cheerleaders. They don't really look like they're that into it. Really, the two in the middle appear to have been forced into it, and there may be somebody just off screen with a gun that we can't see. But you see him standing there pulling it with his teeth. It is kind of an amazing feat, I guess, to be able to do this. And you look at the poster over here on the left, and it looks like kind of a monster truck, type thing that's going on, a big MMA thing. There's sponsors. Here's Ford. Right. We're familiar with that company and a few other companies there. What did you say he got for doing this? What did he win?
A little model plane.
Right.
Of the plane that he pulled.
Right.
Are you kidding?
That's it. Ford's a sponsor.
Shouldn't he get, I don't know, a year of free flights or something?
Or one free flight.
Right.
Yeah, or a cash prize, $10,000.
Something other than, here's a model plane. And I think it's hilarious that he jokingly, started chewing on it. But honestly, for that is unbelievable. I couldn't even push the tire of the plane, let alone pull the whole thing. That is, he should really get something, right?
Yeah, I don't know. I believe so. And I'm going to say it right now. I'm never going to fly Wizz Air again. Now, listen to me, Wizz Air, if you're watching. I don't know if the name Air Urine was already taken. I don't know how you came up with Wizz Air as a name. The only name worse than that is Airbus. You know, when you think of a luxury thing that you want to fly in the Airbus, you know, really?
Air Greyhound.
Yeah, exactly. That was, you know, big dog on the side. So I don't know how they came up with that name. I guess maybe in Europe that's got a different kind of sound to it, a different ring to it that doesn't sound quite like it does here. But just another strange story. Something I don't think you'd see in America, except we already did the story of that guy, remember?
Yes, I do. In
Many
Coney
months
Island.
ago in Coney Island,
Yes.
pulling something with his teeth. That wasn't a dentist, or was it?
No,
it was not a
he
dentist.
was not a
Okay,
dentist.
Good. Thankfully, good. We don't need
Yes.
our image sullied any farther. Thank you so much for
Yes.
that, Megan. That about wraps it up for this edition of Chairside Live. On behalf of myself, Megan, the whole Chairside Live staff, and everybody here at the laboratory, I want to thank you for your time and your continued commitment to quality dentistry.
Have a happy, safe, and healthy 4th of July. See you next week. The nasal spray is called Covacaine Mist and is designed to Sorry, start it over. The nasal spray is called Covacaine Mist and is designed. I messed up the word designed. Sorry. Say it.
Anesthetize.
Anesthetize. Anesthetize. I hate that word. The nasal spray is called Covacaine Mist and is designed to anesthetize. The nasal spray is called Covacaine Mist and is designed to anesthetize. The nasal spray is called Covacaine Mist and is designed to anesthetize the maxillary arch. I said, then I got screwed up on.
That was good enough.